People inevitably look for answers as to why this happened.
One area of focus is how we deal with mental health issues in our communities. News 8's Jenna Traum takes a closer look at why it's an important part of the equation.
Mike and Lisa, the truth is there is no quick fix here. Right now, we don't know what mental health issues the shooter in this case may have had. What's clear is something set him off. And it's touching off a discussion about mental health, how we think about it, how we talk about it, especially in front of young people. When Ryan Kraft was a teenager, he was asked to babysit his next-door neighbor. His name was Adam Lanza, and Adam's mom had an unusual request.
His mom, Nancy, had always instructed me to keep an eye on him at all times and never turn my back or even go to the bathroom or anything like that.
These may have been clues that something was wrong early on, leading some to question how we as a society approach the issue of mental health. Medical College of Wisconsin professor Stephen Hargarden says we should start by responding to mass shootings as a public health concern.
When you have a disease outbreak of a virus infecting communities and causing significant illness and death, you have a response that's multiple sectors looking at what happened, how can you prevent this from occurring.
He says one important part of that is figuring out how the issue of mental health plays into these tragedies.
That is so challenging for us to recognize when an individual is in a risk situation to harm themselves or others, and we need to have thoughtful researchers and other leaders from a variety of sectors to better understand how we can identify these individuals who we need to get into therapy.
Child psychologist Erin Millard says the first step to breaking down barriers to mental health care is erasing the stigma associated with it.
Children learn a lot about what's acceptable based on the responses they receive from others. A couple of ways we can help kids discuss mental health concerns is modeling for them and showing them that we're okay having the conversations ourselves, and also responding to them in a non-judgmental way if they bring up mental health concerns.
Millard tells me parents may want to bring up the issue of mental health care concerns with their children if they notice changes in their behavior or mood, irritability, or if they're having problems at school or with friends. Now, obviously, few children who show those behaviors will actually become violent, and sometimes there just aren't any obvious red flags for a person who could end up lashing out.
Thanks, Jenna. According to online publication Mother Jones, more than 60% of the shooters in mass murders in the past 30 years displayed signs of mental health issues prior to their crimes.